Hi, I'm Lucy Caldwell, and I'm the Director of Communications for the Fairfax County Health Department. Self harm or self injury is anything that a person does with the intent to hurt or cause an injury to themselves, including death. Suicidal ideation is when a person may have suicidal thoughts or ideas. Both of these are risk factors that may lead to suicide. Suicide is defined as death caused by injuring oneself with the intent to die, and it was the second leading cause of death in youth aged 9 to 18 in Virginia from 2016 to 2020. In 2019, 22% of Virginia middle school and 16% of Virginia high school students who took part in a youth risk behavior surveillance survey reported seriously considering suicide. 9 and 7% of middle and high school students reporting making attempts. These are trends that are very, very disturbing. And in Virginia, they also mirror national findings, what we're seeing across the country. There are several factors that increase the risk for suicide. These can include a history of mental health disorders, alcohol and substance use, barriers to accessing mental health treatment, and any type of loss, something that happens to someone, mental health stigma, relationship problems, physical illness, or social isolation. During the COVID pandemic, many of these are highlighted and the risk factors became accentuated. Recent findings reported more suicide attempts in the U.S. youth, and 1 in 3 U.S. high school students participated in a population survey that reported poor mental health during the COVID 19 pandemic. As you know, there is no health without mental health. So today we're taking a look at some of these issues that I was just discussing in our opening, and we're going to continue our mental health conversations to align with May as Mental Health Month. These are difficult topics and they can be hard to talk about. But I do want to tell you that there is hope, and hopefully, some of the information you hear during today's conversation will help you to be a better friend, a better parent, a better listener, because you'll have some resources and you'll know how to support the teenager, the young person, or at any age. Be a friend to someone in their life. You'll know what those protective factors are. You can be and support relationships, access to services here in Fairfax County and around the region, and as well as hoping to increase and strengthen resilience and coping skills, because these are very important factors to prevent self harm and, of course, suicide. To have this conversation, we've invited Dr. René Najera, the Health Department's Substance Use and Mental Health Program Manager. And he's kindly agreed to answer some questions, and he's happy to answer yours as well. So please feel free to pose those questions to us during the next few minutes that we have here. Um, Thank you for being here.
Hi, Lucy. Thank you for having me.
Sure. We're going to start off with some demographic differences. Would you say there are any demographic differences in the rates of self harm and suicide? We see that most of the self harm emergency department visits, 68%, and non fatal self harm hospitalizations, 74%, among Virginia youth were female. But the majority of deaths, sadly and tragically, 71%, are male. How does this apply here in Fairfax County, and why would this be? Are there special risk factors as having a daughter or a granddaughter or a son or a
Mhm.
grandson or somebody you know gender wise? What difference does that make?
Yeah, that's a very good question. It's something that we keep looking at and asking the questions of why are they so different, right? Teenage girls account for most, like you said, most of the visits to emergency departments for suicidal ideation and suicide attempts that end up not being fatal, thankfully, compared to boys. And the dynamics at a society level and within families, etc., is different for boys and girls, right? We treat them differently, whether we think about it or not. And so for girls, a lot of the pressures that come with being a teenager, with issues of body image, issues of peer pressure, issues of what they see around society with regards to how women are treated, they're a burden on them. And so when you're a teenager, your brain is already in a state of flux. All the changes that are happening with your body, with society, with moving from middle school to high school, and all of that, it puts a lot of pressure on girls. And one of the things that we have seen is that girls who do not identify as straights, who are LGBTQ plus, have even higher rates of suicidal ideation and suicide attempts that land them in the emergency department. And so that is one of the other differences, right? Not only how we treat girls, but how we treat girls who themselves are marginalized or outside the norm, what is normal anyway. And so they feel those pressures, and one of the ways that they deal with pressures is self-harm behavior, and unfortunately attempting suicide, when they just feel so much despair for so long that they just don't find it in themselves to go on. With boys, it's a little bit different, right? We treat boys and girls differently. With boys, they are expected to be risk takers. They participate in activities that are inherently a little bit more dangerous on the average than girls. And then they also have access, many children, boys have access to firearms, and firearms accounted for most of the deaths by suicide in young men. And so the combination of these things, along with societal pressures of being a man, becoming a man, these things, well, they also influence in their behavior, and influence as risk factors. And then, Lucy, I mean, the pandemic, right? The pandemic has put an awful lot of pressure on everybody. A lot of the lifelines, talking to people, having a teacher, another friend at school, those were cut off when children did not participate in classes in person. Getting out of the house, doing something different every day, right? That was taken away as well because of the pandemic. And then on top of all of that, then we have the economic circumstances, right? The economy took a hit from the pandemic. We're still seeing the effects of that with inflation and everything. And the children, well, they feel it. And so then it becomes just yet another source of frustration, yet another source of despair for them. And so that's where you see these differences in age groups between boys and girls, and between the younger age groups and the older age groups. Then we get into issues of culture, right? In some cultures, it's perfectly okay for the little boy or the young man to cry and express their feelings and go to somebody and talk about them. In others, it's not. That's a risk factor, because they're not able to talk about what they're feeling and deal with it and get advice and counsel on how to deal with life. Same thing for the girls, except that in some cultures it's more tolerable for girls to express these feelings, but perhaps it's not acceptable for them to act on them and do something about them. And so it's a complex universe of culture, economics, the biology of being a boy, of being a girl, of being anywhere in between, different, etc. And so it's so complicated. We in public health, we try to understand these things at a population level, but also give advice so that people can, at the individual level, take some actions to prevent these events from happening.
This conversation, thank you so much. This conversation is stemming from a new VDH report that has come out about these specific issues about self-harm. And so to point that out, it's been 2 years plus of pandemic communications, and all of the different results that have come from that, not only with serious health illnesses and deaths, but also the emotional health and the wellness issues. And as you brought up, the isolation, which has led to probably many issues that we haven't even seen yet that could come later, depending on the age of children. And so we talk about it from a state level, and we're saying that the state mirrors the national level. But what about here in Fairfax County?
It's
How do
the
we
same.
localize that? And are we, similar to the rest of the state? We have so many resources here and so many excellent partnerships and things to do. And we think about our lives before the pandemic. So what happens now?
Yeah, it's the same, Lucy. It's the same for Fairfax County and in the general area. You know, there are protective factors against this, right? Uh, Being okay with your finances, having a support system, etc. But at the end of the day, nobody is immune to any of this. Any of us can have a mental health crisis, a mental health problem, a mental health disease, and so in that sense, you know, the Fairfax County area is not immune to it. But like you said, there are resources. Thankfully, there's a community services board and all of the wonderful services that they provide. The mental health first aid courses that are available. You go to the community services website and you see there how to sign up for a mental crisis first aid. There's the crisis hotline where people can call and talk to somebody completely anonymous. You know, they will not share any information with anybody unless it's an emergency and you're reaching out for an emergency. And then yes, you know, they'll get you the help that you need. And so we're lucky in that sense. But when it comes to the proportions, right, who is landing in the ERs and unfortunately who is dying from suicide, it mirrors the state and national data. You know, teenage girls that are landing in the ER and young adult men who are unfortunately passing away at the higher rates than the other groups from suicide. And so, you know, we like to talk about the resilience factors that are available, and they're certainly there. And when we talk about suicide and suicidal ideation, it's a small segment of the population, but it's a very preventable thing, Lucy. Like nobody needs to go through any of that. Nobody needs to die by suicide. Absolutely 100% preventable. And we work on that. We work with our community partners, both public and private, to try to address this. The school system, we work with them all the time, and they have wonderful programs within the schools and within the school system to try to identify children who are at risk and provide them services and direct them toward mental health services as well. So it's a lot of that is being done. We're just seeing this increase because, you know, it's a heavy load. It's a lot of people that are being affected by all of this coming together at the same time, and so we're doing our best to keep up.
Thank you so much. And while you talk about that, I'm reminded of one of Fairfax County's programs that's been a result from the Fairfax County Youth Survey. And I think it's really important as a parent or as a grandparent or a neighbor or a friend to remember this. It's called 3 to Succeed. And the Fairfax County Youth Survey shows that teens and children who have 3 or more protective factors are more likely to be able to manage stress, make good life choices, and develop healthy habits. The factors are here. They are to have parents or guardians available to help them, participate in after school activities, have adults to talk to, accept responsibility for their actions, and the final, have teachers who recognize and praise good efforts. So, those are all on the website. If you Google on Fairfax County site 3 to Succeed, there's some really important, interesting information. And you know, being a parent or being someone who cares about young people, it doesn't come with a guidebook on how to have these conversations, on how to prevent, especially somebody, you know, in my generation and around this age group. Um, we did not grow up with screens. And so, you know, the phones are such an important part of so many people, younger people. And through those phones and through the different screens, different people are accessed, and a parent or a loved one may not know. So, therefore, those 3 to Succeed protective factors are more important than ever in a time where you may think someone's okay, you may not outwardly see anything, but it's so critical, isn't it, to know what's going on with your child or that young person that you care about.
Yeah, if you notice 3 of those factors, talking to somebody at home, talking to somebody in the community, and receiving praise or feedback from your teachers, they're all about communication, right? And that's above a lot of other things, being able to talk things out to hear the wisdom and counsel of somebody who's been through what you've been through, somebody that you can identify with, both on personal level or cultural level, and have those conversations with. Very important. And they're called, the official name is 3 to Succeed, but we in public health, we call them resiliency factors. Resiliency is just the ability to bounce back from something that is adverse. It doesn't mean that you don't suffer through adversity. It doesn't mean that you are not feeling bad once in a while, or that you don't react to things. It means that when you do, you have the ability to bounce back and be better afterward. And so some people are just naturally resilient. Other people need to learn it. And one of the ways of learning it is through communication, through talking to people. And like you said, yes, we are becoming a more isolated culture because of the ubiquity of cell phones, social media. I would like to remind people that what you see on social media may not necessarily reflect what is really going on in the social media influencers' lives. A lot of it is just production. It's not reality, and we feel connected to people that are not connected to us, and so there is no connection, and we need to have those connections with people in our lives, and we as adults need to have those connections with the youth, because we have been through a lot of things that they have been through, and we have the wisdom to communicate with them and tell them it's going to be okay. There is help available. There's no shame in crying. There's no shame in feeling sad. I've been there. Let me help you, and connecting. And so you have already in conversations alone, you have 3 of the necessary resiliency factors, right, to succeed. You need not maybe meet the other ones, but at least you have those base ones. Now, having conversations with children can be a little bit difficult, right? I have a 5-year-old, and so whenever she asks about somebody who passes away or what happened, the conversation needs to be tailored to her level of understanding. So very young children, you just explain to them that somebody, if somebody dies from suicide, you just explain to them they just died, and they're no longer with us. And just keep it very simple. The conversation gets a little bit more complex as you move on in age groups. And teenagers, you give a little more detail. You talk to them about what depression is, what the signs and symptoms of depression is, that you're open to talking about depression if they feel depressed, if they feel sad for many days and nothing is making them feel better. You're there for them, and you want to talk to them, and you can help them with it. And that there is help, there's hope, and they're going to get through it. And so on as you get through it. But again, the conversation, the communication, the being there for children. And unfortunately, we see also from the youth survey that a sizable chunk of children, for one reason or another, do not have those communications links. It might be that both parents are working, right? And so there's nobody at home to talk to that is an adult. It might be that they live in an area that the community is just a little more close, and they can't access anybody in the community to talk to. And so we as in public health, we look for programs, and we partner with them to try to bring those people to the community and have them have those conversations with people who need to have those conversations. Mentoring, the school, again, I go back to the schools, a great being lucky to have a great school system, right, where they do provide a lot of these services and help kids in that way, and just kind of build connections. Sure, we're probably beyond the point where we're gonna get rid of social media and kids wanting to participate in social media and viewing it, but we treat it like we explain to children that it is not a connection, even if you feel connected to whoever you're admiring on social media, and that personal connections are best. And if there is a lack of a personal connection, there is the phone lines to reach out to. There are the community organizations to reach out to have that conversation. And then the social activities that kids take part in, having friends, very, very important as well.
And it's almost like, how do you teach someone how to find joy?
Yeah.
How do you do that?
Yeah, it's interesting because we at the end of the day, we learn from others, right? And so having access to somebody who can show you joyful activities, who can help you find what makes you happy, even if that
Yeah,
is reading a book,
right.
as a
And that's
bibliophile.
okay.
Yeah, and it's okay, and it's
Mhm.
fine. I see a question about having a conversation with a 13-year-old boy.
Yes.
The Community Services Board has a lot of material on there on how to have these conversations. And again, it has to be tailored to their level of understanding, also tailored to the cultural differences that we have, right? And so, for some people, for example, upon death, there is the belief that there is life after death, and so you have that conversation in that cultural sense. For others, that might not be the case, and that's okay. But you have that conversation tailored like that. But the honesty and the openness and saying that it's okay, that this This is not something to be ashamed of. This is not something to be tabooed. Feeling sad, feeling hopeless, having those ideations of suicide, you need to tell us. It's like having a headache. We need to get you to the doctor to see what's causing your headache, tummy ache, etc. It's just another symptom of a disease condition, and it can be treated, and it can be addressed.
And public health gets involved in this kind of situation when it does affect populations, right? Traditionally, I'm curious, has public health been involved in youth suicide, or is this a change, an evolution based on what we're seeing in society?
So it's both. Traditionally, there has been research into just keeping up with the numbers and sounding the alarm when the numbers exceed what is expected. It's all data crunching. More recently, we have moved more into the area of looking at programs that are available in other parts of the country and other parts of the world. What has worked? Looking at the scientific development of that program, the science of behavior, the science of biology of growing up, and then consulting with other experts. And we, as epidemiologists, we study the epidemics of these things, and certainly we are in a little bit of an excess, a little bit of an outbreak, and so we look into those. I don't know if the viewers or yourself remember back in 2015 there was a cluster of suicides in Fairfax County, and so we received assistance from the Centers for Disease Control and Prevention (CDC) on investigating what are the risk factors, what happened, and try to give recommendations, which for the most part were carried out by all the agencies that were involved on preventing any more such clusters. And so when that happens, again, we use the tools that we already have available of not only data analysis, but consulting with other experts, bringing the science together, and studying what is going on. And again, that is at the population level. Thankfully, healthcare providers are also more and more involved in mental health issues and recognizing them and knowing how to refer people out to experts to take care of mental health issues. And so more and more physicians, physician assistants, nurse practitioners, nurses, etc., are being trained on recognizing the signs and symptoms of depression, substance use, those kind of things that will lead to bad outcomes, and to talk to people about it and to refer them to services as well. So the work is being done at the population level and with health at the healthcare level as well. We just need the public to learn that there's nothing taboo about it. We need to have those conversations. We need to look out for each other, have somebody to talk to, be there for somebody who needs to talk to us, and just be more open and aware that these programs do exist. Not only through Googling, but also just go to the fairfaxcounty.gov webpage and look for what the Community Services Board and others have available there. Within the school system as well, there is no I don't see a problem in reaching out to the school. And if you notice something with your child, and talk to the school officials as well as to what programs and services are available at the school to help you help your child.
I completely agree with you. Thank you so much for sharing that. Community Services Board has been sponsoring the mental health first aid for several years. And if you haven't heard of it and haven't taken it, truly, it's so important because you'll learn things that you had no idea about, and you'll be better resourced to provide that support to your own networks, your own friends and colleagues and families. So often, when someone does take their own life, people say, I had no idea. We never saw it coming. What could we have done? And people blame themselves. So, to get involved early, to get involved just on a community level, such as you take care of yourself, you might eat right, you might exercise, you might talk to your children and the young ones in your life about those sorts of issues. So keep talking to them about mental health issues too, and make it fun. And I would say probably starting from an early age. Would you agree with that, Dr. Nedha?
Yeah, having those conversations and building those trusting relationships, so that the child, if and when they should have some sort of mental health issue, not just depression, but also uh, substance use, they're feeling peer pressured into something, they'll be wanting to talk to you and reach out to you. So you as the parent, or you as a caregiver, will be working in their best interest to try to help them with this, and moving away from the taboo nature of suicide. and understanding that it is the unfortunate result of a mental health condition, and then mental health conditions are, treatable, preventable, and we can deal with them. We can live with them. They're chronic conditions. They don't have to be deadly conditions. And so, yeah, from a very young age, reaching out and just having those conversations. Of course, easier said than done, right? Parents work. They don't have all the time in the world, as much as they would like to, but carving out a little bit of time to have that conversation with your child will go a long way, not just in preventing self-harm, suicide attempts, etc. It'll also help them with just a boost in their confidence, a boost in their resiliency, and then a performance in academics and sports and everything. Having those conversations really, really makes an impact for young minds, and also among us. It's never too old to learn something new, and so having conversations with people that you see there's a little bit of a change in their behavior. What's going on? Would you like to talk about it? If you don't want to talk about it with me, that's fine. But can I refer you to somebody to talk to? People who manage other people, knowing those resources as well, so that if you recognize that among your coworkers and your colleagues, have that conversation and have the ability to refer them to somebody should they not want to talk to you, or should you not feel comfortable and wanting to talk about these things with them as well. But we need to break down those barriers
Absolutely.
of taboo and
Absolutely. As adults, we don't need to seem perfect to
no,
young people. We can
no,
talk about how we got through things and share our difficulties too.
yeah.
But I really appreciate you being here and joining us for this important conversation. And I'm really encouraged that uh, the health department is working on these issues along with all the other agencies and our partners throughout Fairfax County. And, this issue is not just Virginia. It's not just the US and it's not just Fairfax County. But we do have the services and resources that can help and really
Yeah.
support relationships and give ideas and suggestions because life can feel overwhelming sometimes. But thank
Hmm.
you again. And thank you to everybody who listened and took time out of your busy day to join us. Have a good day.
Thank you so much.